Hi, this is Dr. Miles Spar, again, the third in my series of 3 videos after the AIHM conference to help you feel more empowered on how to reach men, how to get men to come to you more in your offices, and how to really engage them in a way that helps save men's lives. That's what we're really building an army to be able to do a better job at. This one is about how to keep men coming back. We talked last time about how to get men to come into the office, talking about how you want to keep it very focused, give them one thing to do at a time, and maybe partner with women's clinics to get the women to promote the idea of men coming to you. Today I want to talk about how to keep men engaged. And it is an extension of what I talked about in my talk at AIHM. Number one, keep yourself and the patient accountable. No matter what instructions and recommendations you give a patient to do, you need to make sure they feel that you are holding yourself accountable, that if they follow that instruction, they are going to achieve the outcomes that they told you that they care about. So make sure you link your recommendations for them, whether it's changing their exercise program a little bit or changing their diet, adding a supplement, changing medications, doing a meditation program. Explain clearly how that is going to impact their outcome of interest. And then you are going to hold them accountable. What do you expect them to report back on you on? Ideally, have them use a wearable. I love my Garmin watch. I'm obsessed with it. It can track my sleep and my exercise. But if not, just have them report in how many times a week they did what you discussed. So make the expectations clear that you're holding yourself accountable and you're going to hold them accountable. Number two, use that accountability to foster a sense of competition either with themselves or with others. If they want to be more active and they're not somebody that wants to go to the gym, find out how they can do something in a competitive way, joining a team or using an app that helps them compete against themselves so they can see how they're progressing. It could be something like Strava or Map My Run or something where they can compare how they're doing and see how they're developing over time, as well as having a sense of community. Some of these apps enable you to kind of have a social media, social community aspect to it. So accountability, community, competition. Those are the 3 tricks for keeping men coming back, but still going back to what I said before, keep the visits short, goal-focused, one recommendation at a time. And if you want to hear more, let's do an extended webinar. I'm going to do a mini course where we can really interact more and we can go way more into depth about how to build a men's health practice and what we can do to keep men engaged and responsive and making the behavior changes we know that are going to make such a big difference in their lives. So check out the email that has a link to sign up for that webinar, and I'll see you soon when we do that. Take care.